For my project, I had to research Turner syndrome. Follow along and look for the words that are red for your word search. Turner syndrome is a chromosomal disorder where one X chromosome is completely or partially absent. Our DNA is made up of 46 chromosomes, or 23 pairs of chromosomes. Our 23rd pair is the sex hormone that determines the sex we are born. The female pair is XX. The male pair is XY. In this pair of chromosomes, one comes from the mother and one comes from the father. Typically, in Turner syndrome, the sperm cell is usually the chromosome that is completely or partially absent. How common is Turner syndrome? It affects about 1 in 2,500 babies assigned female at birth. This is common as cystic fibrosis or cryptic pregnancy. Who can get Turner syndrome? Only females get Turner syndrome. The symptoms can range from mild to severe, and people can go their whole lives without knowing. There are two main types of Turner syndrome: Monosomy 45X and Mosaicism 45X0. Monosomy 45X. This means the person only has 45 chromosomes. With Turner syndrome during meiosis, non-disjunction can occur, meaning the chromosomes didn't get split apart. Following meiosis, you would see two cells with an extra chromosome and second with none. Or in the second step, one cell missing a chromosome, one cell missing, and one regular with two chromosomes. Mosaicisms 45X0 means some chromosomes with 45X and 46XX. The first type is the second most common type of Turner syndrome after monosomy. During mosaicism, a single-celled zygote has non-disjunction during meiosis. Or a part is missing due to the arm of the chromosome being deleted. How each system is affected. In the skeletal system, abnormalities including curvature of the spine, a short fourth finger or toe, teeth problems, short stature, can be seen. This can be due to their bodies not responding to the normal levels of growth hormone they have. Brittle bones are also seen due to low estrogen levels and may lead to osteoporosis. In the integumentary system, you may see cystic hygroma that decreases as they age, but leaves extra skin around neck, causing neck webbing along with skin conditions like psoriasis. The muscular system is affected due to loss of muscle coordination. In the nervous system, you can see sensorineural hearing loss due to a gradual loss of nerve function. Increased risk for seizures, migraines, and ataxia, also known as impaired coordination. The endocrine system is the most impacted system, and we see elevated FSH and LH due to ovarian failure and reduced ovarian feedback. Risk for type 2 diabetes and hypothyroidism due to underactive thyroid gland. Low levels of estrogen and androgens are 30 to 50% lower than healthy females. As a result, almost every system is impacted from the endocrine system, either making too many hormones like FSH or LH, or not enough, leading to the body never being able to maintain homeostasis even with treatments. We will learn about this when we look at a case study in a few slides. The cardiovascular system is predisposed to cardiovascular defects, like coarctation of the aorta and bicuspid aortic valve. This may cause lower extremity cyanosis and edema are a result and can lead to heart failure. In the lymphatic system, lymphedema, frequent infections like urinary and ER. You also may see the cystic hygroma as a result of lymphatic system building up with fluid around the neck. This is also seen in the arms and legs, especially in infants. The digestive system may present with inflammatory bowel disease, Crohn's disease, and celiac disease. In the respiratory system, there may be impaired breathing or oxygen exchange due to lymphedema around the neck and pulmonary edema as a result from heart failure. The urinary system may present with frequent urinary infections due to the kidneys fusing together. The reproductive system is arguably the second most affected system due to the hypergonadotropic hypogonadism that can be a condition caused by Turner syndrome. This is also known as primary gonadal failure. In this syndrome, the follicle-stimulating hormone, FSH, and luteinizing hormone, LH, are at high levels, leading due to ovarian failure and reduced ovarian feedback. This starts while they are only a fetus. By week 18 of gestation, premature degeneration of ovarian follicles begins and ovarian follicles are replaced by abundant connective tissue causes streak gonad. Due to this, amenorrhea is typical by 15 and no breast development by age 13 is seen, as well as the streak ovaries, leaving most females are infertile. What are the tests to diagnose? A blood sample of the karyotype can be done while pregnant to diagnose before birth. After birth, an ultrasound can be done to check the kidneys. Heart defects and cystic hygroma can be tested by a cardiologist doing an ultrasound on your heart and neck. They can also test fasting blood sugar for type 2 diabetes. There is no cure for Turner syndrome. Treatments include growth hormone therapy to promote height and bone growth. This only works if given in early childhood, before the child reaches adult age. This may increase the risk of colon cancer or Hodgkin disease. Hormone replacement therapy may be given to promote breast and hormone development. Estrogen replacement therapy can also be given to prevent bone loss. And in vitro fertilization can make pregnancy possible for some women. A recent study in Canada gave 154 children born with Turner syndrome, growth hormone, or no treatment at all. 61 to 78 of the children were treated and 43 to 78 were controls. Both groups were observed until adult height was reached. There was 95% confidence that there was a 7.2 centimeters mean difference between the group's height from the beginning to the end. The mean duration of treatment was 5.7 years. 88% of the children were happy with the outcome, 9% were neutral, and 3% were negative about the outcome. But 64% of the cases thought they would have grown above 8 centimeters and did not consider the treatment worthwhile. During the treatment, it was also observed otitis media risk doubled with growth hormone treatment. So they were able to prove a small height increase, but 64% of the children who were now adult would not go through the treatment again. This is likely due to the growth hormone not being sufficient in maintaining their body in homeostasis, as it could not fix the rest of the issues going on with their body systems. This study was one of many that showed the treatments available could help somewhat with the effects of Turner syndrome, but could not cure and could often lead to causing more damage than good. How does Turner syndrome link to my profession? I am currently a licensed practical nurse. Due to my profession, I take care of a lot of people on a daily basis. As of right now, I work in long-term care, but once I get my RN, I will likely be more exposed to a greater variety of people working in the hospital on a daily basis, increasing my odds of meeting someone who has Turner syndrome.